What does relapsed Ewing sarcoma mean for prognosis? When Ewing sarcoma comes back after initial treatment, it's called relapse. This means the cancer has returned after a period of remission. The outlook for patients with relapsed Ewing sarcoma is generally more challenging than at initial diagnosis. Survival rates after relapse tend to be lower, and many factors influence the prognosis. One important aspect is how soon the cancer returns. If relapse happens more than 18 to 24 months after the first treatment, patients tend to have better chances of survival. In these cases, 5-year survival rates can be around 29 to 35%. But if the relapse occurs within the first 2 years, the outlook is usually less favorable, with less than 10% of patients surviving 5 years after relapse. The timing of relapse is a key factor in predicting outcomes. Another critical factor is where the cancer comes back. If the relapse is limited to the original tumor site or just the lungs, patients generally have a better chance of survival. In these cases, 5-year survival rates can be around 22 to 24%. However, if the cancer spreads to bones, bone marrow, or multiple parts of the body, the prognosis becomes more serious, with survival rates often falling below 10%. The location and extent of the relapse play a big role in determining the outlook. The treatments used at relapse also matter. Aggressive approaches like high-dose chemotherapy, surgery, or radiation therapy can improve survival chances for some patients. When these treatments successfully control the disease locally, patients may live longer. But the success of these options depends on individual circumstances, such as whether the cancer has spread to bones or bone marrow. Timing of relapse during initial therapy is another important point. If the cancer relapses while the patient is still undergoing treatment, or if the disease progresses despite therapy, the prognosis tends to be worse. Conversely, relapse after completing the first line of treatment can sometimes be managed better with additional therapies. Currently, there is no single standard treatment that works for everyone after relapse. Some patients benefit from intensive chemotherapy and stem cell transplants, but research is ongoing to find the most effective strategies. Overall, relapsed Ewing sarcoma remains a serious challenge, and the chances of cure are limited. However, individual factors like how late the relapse occurs, where the cancer recurs, and the treatments used can influence outcomes. Patients should work closely with their healthcare team to explore personalized options and stay informed about new research that might improve future prognosis. Always remember, medical advances continue, and ongoing research aims to improve survival and quality of life for those facing relapsed Ewing sarcoma.